Microvascular compression of the vestibulocochlear nerve. The microvascular compression of the vestibulocochlear nerve, also known as neurovascular compression syndrome or vascular compression syndrome, is a medical condition characterized by the compression of the vestibulocochlear nerve, cranial nerve VIII, by nearby blood vessels. This compression can lead to a variety of neurological symptoms including tinnitus, hearing loss, vertigo, and imbalance. Understanding the mechanisms, clinical manifestations, and management of microvascular compression of the vestibulocochlear nerve is essential for accurate diagnosis and appropriate treatment of affected individuals. Mechanism of compression. Microvascular compression occurs when blood vessels, typically arteries, come into direct contact with or exert pressure on the vestibulocochlear nerve as it travels through the cerebellopontine angle (CPA) near the brainstem. The compression may result from anatomical variations, such as the tortuosity, loops, or aberrant course of blood vessels, causing them to impinge on the nerve and disrupt its function. The exact mechanism by which vascular compression leads to neurological symptoms, including tinnitus and hearing loss, is not fully understood, but may involve distortion or irritation of the nerve fibers, ischemia, or changes in neural firing patterns. Clinical manifestations. Microvascular compression of the vestibulocochlear nerve can present with a variety of symptoms, which may vary in severity and duration among affected individuals. Tinnitus is one of the hallmark symptoms of neurovascular compression syndrome and is often described as a ringing, buzzing, hissing, or roaring sound perceived in one or both ears. Hearing loss, typically sensorineural in nature, may occur unilaterally or bilaterally and may affect high-frequency sounds initially before progressing to involve a broader range of frequencies. Vertigo and imbalance may also occur as a result of vestibular dysfunction, secondary to nerve compression, leading to episodes of dizziness, spinning sensations, and disequilibrium. Diagnostic evaluation. Diagnosis of microvascular compression of the vestibulocochlear nerve often involves a comprehensive clinical evaluation, including a detailed medical history, physical examination, and specialized diagnostic tests. Magnetic resonance imaging (MRI) with high-resolution sequences, such as constructive interference in steady-state (CIS) or heavily T2-weighted sequences, is the imaging modality of choice for detecting vascular compression of the cranial nerves and ruling out other structural abnormalities. Management and treatment. The management of microvascular compression of the vestibulocochlear nerve depends on the severity of symptoms, the degree of nerve compression, and the individual's overall health status. Conservative management options may include observation, lifestyle modifications, e.g., avoiding triggers for symptoms, vestibular rehabilitation therapy, and pharmacotherapy to alleviate symptoms, e.g., anti-dizziness medications. Surgical decompression of the vestibulocochlear nerve may be considered in cases of severe or refractory symptoms, particularly when conservative measures fail to provide adequate relief. Microvascular decompression surgery involves mobilizing or repositioning the compressive blood vessel away from the affected nerve to relieve pressure and restore normal nerve function. In summary, microvascular compression of the vestibulocochlear nerve is a medical condition characterized by the compression of the vestibulocochlear nerve by nearby blood vessels, leading to neurological symptoms such as tinnitus, hearing loss, vertigo, and imbalance. Accurate diagnosis and appropriate management of microvascular compression syndrome are essential for alleviating symptoms, improving quality of life, and preventing further neurological complications for affected individuals.